The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. Thank you so much for joining us. This is Francesca from the San Francisco Marin Food Bank. I'll be moderating today. Really excited to have both of our speakers, Jessica Bartholow from the Western Center on Law and Poverty and Maria Abarca from the Neighborhood Healthcare Center based in East San Diego County. Just a reminder, the session is being recorded and it will be available about a week after we are done. So also one more reminder, if you have any questions, please feel free to type them into the question box at any time during the presentation, and we will go through them at the designated periods. So Jessica Bartholow is a legislative advocate at the Western Center on Law and Poverty with nearly 2 decades of experience in anti-poverty organizing, advocacy, and program development at the local, state, and national level. Jessica has co-authored several advocate and program guides and led coalitions to support the passage of several pieces of FEN legislation that improve public benefits delivery, consumer protections, and financial empowerment for low-income Americans. And with that, I will turn it over to Jessica.
Jess, I think you may be muted.
Hi, this is Jessica. I was muted. So sorry. My introduction was ravishing, but let me start with this. This is Jessica Bartholow with the Western Center on Law and Poverty, and as I understand from Stephanie, there are over 100 people on today's call. So we want to just do a quick shout out and thank the Association of Food Banks for sponsoring today's call, hosting it, and making sure we all got on and unmuted appropriately. You know, just before we get on the call today, I was talking about how important it is to have these kinds of outreach and opportunities to share about the new law and how it'll work. Because it doesn't matter if there's laws on the books, if people don't know about them, if when they go into their county social services agency and they're discouraged with the misinformation, or they don't know that when they applied last year, the rules that applied to them are no longer in place. So the role that you have to help spread the word across the state of California of this great new law is so important. Let's dive into what we're talking about. Next slide, please. So the policy, and yeah, there we go. The policy that we're talking about is the repeal of an optional lifetime ban on people who have a prior drug felony conviction from receiving CalFresh or CalWorks assistance. And under CalWorks, that includes job training and support, transportation to and from work, and also child care for children who are in homes with an adult with a prior drug felony conviction. So this ban reached far into the families, some of the poorest families in our state, and some of the poorest communities, made them hungrier, more likely to be homeless, more destitute, and with fewer options. Repealing the ban has been part of a longer than a decade effort with so many great leaders in the community and organizational commitment to make this happen. And some of them are listed here, as you see, but really there were hundreds of people and organizations who contributed to this effort over the years. Next slide, please. When we talk about the ban, as I said before, I'm not sure why, there we go. Specifically what it did was denied $128 a month in aid to adults in a household where children in the households were receiving CalWorks. So those households still receive CalWorks. They're still on the caseload, but the adult in their household was denied aid, and that was $128 a month as of this year, the amount. And also they were denied, like I said before, access to welfare to work services. And because of that, their child was denied child care, subsidized child care. Rosie was one of the wonderful spokespeople who was impacted by this law and spoke about it at the state capitol. And as she said, the impact was that if she found work, she had to find work at a place where she could take her son along. And so he would ride buses with her and go clean houses with her. And can you imagine that this is a policy we thought was fair to any child, having to to live out the punishment long past the time at which their parent had served their time, and in fact, in many cases, the parent serving the time even before the child was conceived. Again, this not only impacted families, but it also impacted food banks and rehab centers and child care centers, all places that were trying to fill in the gaps for this denial of aid. Specifically, the food banks were impacted by the CalFresh portion of the ban, which had been partially repealed in 2004 with then Assemblymember Leno's bill, which repealed it for people who had minor use and possession. But the food banks were still seeing people come in who were banned from CalFresh because of an intent to sale, or maybe they had enough that qualified them to be considered trafficking if they had the drugs in a vehicle, for example. So we saw extra pressure on the food banks and rehab centers. Again, rehab centers having to bear the whole cost of serving meals to people who are in rehab following jail time, and also to child care, as I mentioned before. There were, increased recidivism. Report after report from bipartisan research centers showed that people who were impacted by these lifetime bans across the country were more likely to recidivate. Why? Because they lacked basic needs. And when they lacked basic needs, they were more likely to fall back on addiction and also on lives of crime, to be able to raise enough money just to get a bed to sleep in. And not only does that make our prisons fuller, not only does that remove opportunity further from people who've been convicted of the crime, but it also makes our communities less safer. The word recidivate, it means another crime committed, and those crimes are committed mostly in low-income communities. So this correlation between lack of opportunity, lack of basic needs met, increased recidivism, and increased crime is really what helped focus legislators on ending the ban. And we also found from reports from PPIC, Public Policy Institute of California, that when adults were banned from assistance through this lifetime ban, they were more likely to be on aid longer. So the idea was to punish the adults and maybe, I suppose, save the state some money, $128 a month. But what it really ended up doing is prolonging the period of time that families who were poor and had multiple barriers to work depended on the program for their children to have benefits. Next slide, please. The nail that hit the coffin of this policy was that there was evidence of all of these things, that the lifetime ban impacted us in negative ways in all of these things, and not a single shred of evidence that that people, children, communities, our prison systems, that none of it was better because of these lifetime bans. So what was the context in which this policy was changed? As I said before, there was over a decade of advocacy work that went on in this work, and while we all built very strong relationships and community around the repeal of the ban and over the decade-long effort that it took, I know that I feel very sad that we couldn't have made this happen for people sooner. As celebratory as we can be today, I'm humiliated by the fact that we can't say to people we got it done sooner, and by the fact that so many people and children were raised in environments that was less than they needed because of a parent's prior drug felony conviction, and we didn't get it done. So it's important to kind of look and see why it was what happened this time that got it done. First of all, prison realignment. Happened, and what that really is about was a proposal that drove the cost of prison and jail to counties. So the same people who would be making decisions about benefits with the County Human Services Agency and the Board of Supervisors there, and arrests through the sheriffs, would also be responsible for bearing the cost of imprisonment. And that made them more of a partner in helping us figure out how to reduce crime and reincarceration. You know, and this all under the context that there was clearly much for us to learn from other states, California having the second highest recidivism rate in the country. When we looked at the rates of the other states that had reduced recidivism, we noticed on the public benefit side, in large part they were states that didn't have the ban. You know, the state had a court order to reduce the prison size, and there was clear evidence that this was something that contributes to an increase in recidivism and therefore prison and prison size and population. So we could make that argument. And all of this, though within a context of several failed attempts, it allowed us to kind of continue to repeat that this is something we've been saying is a solution to problems the state is seeing, and we'd like it to be considered. Let's go to the next slide, please. Great. So what happened? We, you know, through the bicameral, so both the Senate and the Assembly called for an end to the lifetime ban in their public safety budgets. And they did this by calling for an equitable treatment of felony convictions, basically saying, look, you know, all felonies should be treated the same. Felony convictions should be treated the same vis-a-vis our public benefit system. They maintain that the ban must still apply if people are not complying with their probation or parole, right? If people are following the rules once they exit, they should be eligible for the benefit. And with regards to drug rehabilitation, it's required if it's required by probation or parole. Most importantly, I just want to focus this because I really hope people in the community can join in on this work, which is we didn't just change the law, we also changed what the law said when it referred to people with prior drug felony convictions. This portion of the law referred to people previously as drug felons. The law very intentfully removed that, struck that language, and replaced it with the words people or person with a prior drug felony conviction. Right? That people, once they serve their time, are no longer to be considered drug felons, forever labeled, forever made hungry, forever treated differently. But they're people who have human needs, like eating and resting in a safe environment. And they had a prior drug felony conviction. Okay? So the law will treat them differently in some pieces, but they're still people. They're no longer felons. All right. Next slide, please. So what's the timeline? The timeline on this. This is what you're all here to listen and participate in. So beginning August, last August, there was a letter sent out. It was called an All County Welfare Directors letter. Went to the directors of all the agencies in each county that said, hey, this law's coming. Get ready. Assign somebody. Let's make some time in your staff's time, your work plans to get rid of this law. In December, an all-county letter, December 19th, I'll give you the link to it on this, and this, as I understand this presentation, will show up on the website thanks to California Association of Food Banks later, along with this video audio taping of this presentation. So don't feel like you have to search for it. But December 7th, or December 19th, there was an all-county letter sent that implemented the instructions. The counties were instructed to broadly educate applicants through signage and one-on-one conversations as households came in, starting January 1st. So this means you should have already started seeing these signs up in your welfare offices, your county human services offices in your state or in your county, and the households impacted by the ban should start having conversations with their workers already. As of February 18th, the counties must notify all individuals banned if they have a recipient in the household who is banned, and notify them of anything. By the 28th, they're supposed to have notified them of any required eligibility materials or documents that they should have received. By March 1st, people who go in to apply, their applications should be continued so that they can become eligible as of April 1st. And on the 20th, households that have a person banned must be informed that the ban is ending and what their new benefit structure will be. April 1st, everything changes. The new law is in place. Nobody shall ever be denied again because of this lifetime ban in California, and all households with benefits that start the first, but may be staggered, right? Some food stamp benefits, some CalFresh benefits are staggered. They're when they're loaded to the card. Those benefits will begin the first. April benefits should all reflect people in the household who had previously been banned, and they will, and everybody who comes in should be approved for aid if otherwise eligible. The next slide. The next slide should be, in case I got ahead of myself, links and resources. I believe you showed the timeline. So the links and the resources, just to let you know that I've provided here for you, these are live links and they'll be made available online. Various pieces of materials that I think you'll find helpful as you begin to do outreach or continue your outreach in the community. And I hope also that you'll reach out to each other and share materials and information that you find, and that you'll reach out to us. If you learn that your County Human Services Office doesn't have a sign-up, I'd like to know. If you learn of somebody being denied eligibility after the 1st of April, we really want to know that. We know that this is a big change, and it's kind of ingrained in the process in the system, and it's going to take all of us helping each other to learn the new rules and get out the word. So please, don't feel like a tattletale. If you see something not fitting into what you see on the timeline or not fitting into the instructions and materials and outreach that I've provided on your links, let us know. And you can go to the last slide now, Stephanie, which is just basically my contact information. And again, this will be provided online along with the audio of this presentation, thanks to the Association of Food Banks. And I believe that the next, our next staging for this conversation is for Q&As from me, from people in the queue, and I'll hand it back over to the moderator.
Thank you so much, Jess. That was a beautiful presentation. I especially appreciate what you said about people being referred to as drug felons. I think it's really important to keep people human. Anyway, we have some questions. Let's see, one person wants a copy of the timeline, which I'm sure will be on the California Association of Food Banks website after the presentation is posted. We have one question. Will the counties automatically be restoring benefits for households that are already participating? Is that something that's automated through the computer systems?
Yeah, that was something that is detailed in the December 19th letter, that those people's benefits will be restored. And if somebody doesn't have a letter informing them that their benefits will be restored and what the new benefit level will be, if it doesn't get sent out by the I think on the timeline I have the 28th, 2018, the last week of February, if they don't have that letter, then they should proactively reach out to their worker, because the counties are supposed to send an informing letter on the 18th and another one on the following week to let them know what their benefit level will be.
Great. And then another question regarding Prop 47. I'm sure you probably were expecting us to talk about that. As far as the timeline goes, is everything, are people's, well, basically, can you just speak to that as far as people's?
No, I think that's an excellent question. It's a very relevant question. So, this policy change was going along right as Prop 47 was placed on the ballot and going forward for voters to decide. And to remind people who are listening, since I think we have a little bit of extra time, Prop 47 was a measure which called for reducing the crime of minor drug possession or use without violence, any drug felony conviction that didn't involve violence, reducing that to a misdemeanor felony. I guess restoring misdemeanor felony to that type of conviction. It used to be that was what people would be given, and over the years through the war on drugs, quote unquote, those possessions and use had been changed to felony drug convictions. So it's definitely a similar population, right? An overlap population of people. The voters did elect to enact Prop 47, which again immediately reduced the crime, so nobody moving forward would be convicted of a felony if it was nonviolent use or possession of crime, of drugs, and also allowing people the opportunity to reclassify existing felony convictions into a misdemeanor. And you know, Western Center on Law and Poverty is not an expert on this area of law, but I did provide in the links and resources a link to an organization that is an expert and was leading on Prop 47, and they have an entire page dedicated to how people can reclassify their convictions. And I would say that if you're talking to people with prior drug felony convictions about this change in CalWorks or CalFresh law, it's also a great opportunity to inform them about this opportunity to reclassify their felony conviction. Because if they're eligible for a reclassification, a lot of things change for them. Not just CalWorks and CalFresh, but they might be eligible for housing subsidies. They might be eligible for educational support they're not currently eligible for. They wouldn't have to mark on their employment that they had a felony conviction. Remember the rules about ban the box legislation that has been passing in municipal governments and successful at state level are very narrowly applied to public sector employment. But private sector employment still widely asks about felony convictions. If somebody can reclassify their conviction to a misdemeanor, that's going to help them in a lot of other ways. So it's a great two-for opportunity to educate people about both of the changes in law.
Okay, great. Thank you so much. That's super duper helpful. Let's see. One thing that I want to just clarify about what you just said, it sounds like people need to reclassify whatever felony that they got themselves, right? It sounds like they have to be proactive about it.
Yeah, they do have to, and that's why I refer them to the web page. There are instructions for how to do that. And just as a reminder, you don't have to do that in order to be eligible for CalFresh and CalWorks moving past April 1. So these are two completely different processes. But again, helpful to provide information about it at the same time.
Great. And then let's do one last question. So this question is basically a household of one. If somebody applied for CalFresh, or maybe if it was a multiple-person household and they applied for CalWorks, were denied because of a drug felony that they had, would they get a letter, or are they only going to be contacting households that are currently receiving benefits?
Right. We had tried. We had suggested that maybe they reach back into the files and go back to people who had been previously denied, like in the last 6 months or last year. So, sometimes the state and the counties are hesitant to do that because very poor people move a lot, and you can spend quite a lot of money sending a mailer out. And when a lot of them bounce back, it's hard to justify the costs. So unfortunately, we did not. We were not successful in convincing them that that was a good investment. But it might be something that they would be willing to do, and after they get through this initial bout of implementation. It's taken a lot of work to get us to kind of where we're at with implementation April 1. And I feel really good that everything's in place and ready to go. But after that, we'll see if they'll take another look at perhaps going back to people denied previously, maybe even just back to January 1. So, unfortunately, the answer right now is that only those people who have an existing case or somebody in that case is being banned will be informed proactively of the law change and will be automatically eligible. Anybody who lives in a household by themselves and so therefore isn't currently receiving aid because they have been banned due to a drug felony conviction, or perhaps they're living with somebody else who also has a ban. Any household like that will have to be proactive and go out and apply for their benefits. We say go in March so that you can start getting them in April. Don't wait till April, because then you might not start getting benefits until May.
Right. Yeah, I just wanted to reiterate again that you said that people can start applying as soon as March 1st. We don't actually have to wait for the April deadline, or the April beginning. Let's squeeze in one more question since we have a little bit of extra time. One question was, does the lift in the ban include felonies having to do with the manufacturing of drugs?
Everything. Every felony conviction will now be treated exactly the same in the CalFresh and CalWorks program, and that is, if you have a felony conviction and you're fleeing from the law, you're not eligible for aid. If you have a felony conviction and you're not complying with probation or parole, you're banned from receiving aid. Every other person who has a felony conviction, no matter what reason, will be treated the same in the programs.
Great. Beautiful. Thank you so much, Jess. That was a really great presentation, super helpful information. Just a reminder to everybody, you can submit questions at any time, including questions for Jess. If you want to have some at the end, we will definitely have time for Q&A. And we'll be moving on. Again, thank you so much, Jess, for that information. We all really appreciate it. And so we're going to be moving on to Maria Abarca's presentation, and she is a certified enrollment counselor from the Neighborhood Healthcare Center based in East San Diego County. With that, I will let her take it away.
Hi, good afternoon. I'm Maria Abarca. I'm a certified enrollment counselor at Neighborhood Healthcare, and we are working with the County of San Diego Probation Department in El Cajon. We are working with the Affordable Care Act program. We are stationed there Tuesdays from noon to 4. We conduct an orientation. We actually pass out the orientation presentation so that they're free to take it home with them. We also assist with the application process with the Covered California and Medi-Cal. Since we also work with the CalFresh, we offer them the assistance to this other service. We started working with this program since October 2014, and yeah, it's been a good experience to being able to offer this assistance with these people, and being able to not only, like, our main focus is the health insurance, but it's like a plus to being able to assist them with the CalFresh also.
Maria, this is Stephanie. Could you talk a little bit about the work that you're doing in the jails to reach out to folks who are about to re-enter?
Well, sure. We don't help out people that are in jail. We are stationed only at the probation department, so we outreach to them. We also assist them with not only the enrollment process, but to troubleshoot. So, if they already have like an ongoing case where they applied already and haven't heard anything from the county in regards to their coverage, we can troubleshoot their case. Also, the probation officers and the clerks assist us with setting up the appointments. So when we get there, we are already scheduled appointments. We attend the presentation or with the orientation, and yeah, we're there to assist them until, like I said, 4:30, from 12 noon to 4:30. And it's very rewarding to see how people are grateful to being able to have this assistance there and not have to go to the Health and Human Resource Center. So it's very rewarding to see how grateful they are. And like some challenges are for every program that starts, you know, it's that it takes time to build up a relationship and get the word out that we're there, and, you know, just kind of getting them ready to decide to apply. But it's been working.
That's great, Maria. Would you be able to give advice for people that are interested in potentially starting outreach in this sort of way? How did you make those connections?
Well, I don't know about like the connection because of, yeah, we were just like, I don't have any, they're all like grants and programs that are already like set up. But what I can tell them is for anyone that wants to start working with this program, it's, you know, it's very challenging at the beginning, just like any other program is, but it's very rewarding to see how people can benefit from these services.
Great. Is there any particular lessons that you've learned from working, you know, in the setting that you would be able to share with people that maybe haven't had that experience?
Well, I guess the main one is be patient. Be patient, and, you know, there's a lot of people that don't show up to the appointment because they have the option to set it up there or at our medical facility. But, you know, just to be patient and being able to be flexible to make programs work, follow-up calls, and, you know, reschedule when needed.
This is Jessica. Can you hear me?
Yes. Go ahead, Jess.
I have a question that I've been dying to ask about these programs. You know, one of the things that I've learned in working on Repeal the Ban is that so many people who are impacted by the ban are people who really could have used access to health care and especially mental health services. And in fact, their lack of access to mental health services may have actually been what led them to self-medication through drug addiction. And so I think it's an amazing thing that people coming out of prison now can have access to mental health services and to health care. And I assume that the program that you're working with is part of AB 720 by Assemblywoman Skinner, a bill that was introduced to help make sure that as people transition right out of prison or jail, they have access to health care as soon as possible. So I assume that part of this process is to help people get the mental health services that they probably have always needed. Do you find that that's the case, and how hard, you know, what are the things that can be done to help more quickly connect people who are connected to health care than to mental health services?
Well, I know that there is other organizations stationed in the jails assisting with getting coverage, and I think that's very important because you're right. A lot of the times they have issues where they need mental health care and medications, and so we are not stationed at the jails, but I know some organizations that are, and that is like very important. That we do have, we're building up a good relationship with the probation officers, and, you know, they're getting to know us, and I guess getting reminded to ask, you know, are you insured, and letting them know how important it is to have it, and, you know, that we're there to assist them. And so it's getting started to working together, and they kind of like encourage the people to get it because they see they need medical attention. And not only that, but with the new law of having health insurance with the Affordable Care Act, that's also like important.
Great. How were you able to connect with the probation officers to reach reentry populations? Do you know like who people should try to contact in their own counties? Do you have any advice for people?
Honestly, I don't, but I know if you are interested, you can email me and I can give you more information of someone that might know so that they, can tell you who to speak to and how to get connected.
Great, thanks. So I just want to remind everybody, if you have any questions, we're going to open it up to Q&A at this point. Feel free to type them in and we will sift through them. Let's see if we have any right now. This question was for Jess. Do you know if this new, the lifting of this ban has opened any conversation to lifting a ban for people that have been convicted for fraud for selling or trading benefits?
No. That's a great question. So just remember that under CalFresh law and I believe under Cowers law as well, though I'm not as confident, there is a ban for receiving assistance up to a period of time for the first conviction and lifetime if you're caught trafficking the benefits, and that's a federal law, and it's not an optional state law, and does not appear to be a conversation about changing that. I think when it comes to integrity of the program, trafficking of the benefits, which means selling your card for benefits, was actually one of the things that really helped us convince lawmakers to change this law. To remember that, if people are using the benefits for food, then they can't use it for drugs. And if there are, if there are repercussions for selling the benefit in order to have money to use it for drugs, then it makes more sense for lawmakers to support repealing the ban for people with prior drug felony convictions. That was some of the arguments that people could, made this policy change more palatable for them. I don't see that policy changing anytime soon. In fact, I see probably more aggressive pursuit of people who are abusing the program, selling the benefits, not using it for food, and intentionally lying in order to receive more benefits or to receive benefits, period. I want to point out here that when we talk about fraud to the program, a lot of times people will blame poor SNAP recipients, CalFresh recipients, because of, when they hear of cases where people have, a whole bunch of money because they have all these cases open. In those scenarios, the people who are scamming the system, they're not poor Californians. They're not poor Americans. In fact, they have a lot of income. They're thieves, and they're thieves who are benefiting from the program specifically because they've lied to it. They're using increasingly more technology to rob and steal from the program, and the only people that hurts in the end are the recipients in the program. So no, this would not in any way change those rules, change ineligibility for, for misuse of the program, and I don't think that's going to change.
Great, thank you for clarifying that. Let's see, we have a question for Maria. Is there anything that you've learned as far as, particular lessons? How are you dealing with equipment and Wi-Fi and just logistical things that you have to work out being off-site in such a different place?
Well, we take our own laptop and the Wi-Fi to get connected there. We do the paper applications instead of doing them online. But we use the internet to check the eligibility online, and we take our own cell phone to conduct three-way calls to the county if needed.
Great, thank you. And then a question for Jess. Jess, do you know of any materials, any particular flyers that have been made or put together to start informing the public about the changes?
Yes, so in coalition with the kind of the group of organizations that work to repeal the law, we did create a flyer, and just in English and Spanish, or English, only in English. That was our organizational capacity, but we have a CalWorks and a CalFresh one. And additionally, our partners and allies in San Diego created a Spanish language one, and I have a copy of that one in addition to the English CalWorks and CalFresh one on our blog post about the repeal, which the link to that is on the presentation that will be posted. But it's also, if you want to write it down, it's www.tinyurl.com/lift-the-ban April 2015. Lift the ban April 2015. And again, this link is available on the presentation that CAFB will post. So they'll be available there. And if people have the capacity, the organizational capacity to translate the flyers in other languages and can share those, please do send them out to us, and we can get them out to others.
Jess, do you know of any particularly high-need languages that you would want people to try to find translation capacity for?
No, I mean, I think the majority of people who will have this ban impacting their eligibility are English language speakers, and Spanish was a quick second. But no. Remember that people with a felony conviction, if they are immigrants, they likely will have other complications to becoming eligible to CalFresh in California.
Great, thank you guys. So let's see, I'm gonna just let you guys know if you have any questions. We are about to wrap up pretty soon, a little bit early here. So send those last minute questions in if you have any. We are going to put up a slide that was up in the beginning. I'm not sure if you all got a chance to check it out. It's from Root and Rebound, and it has a lot of great information for all of us to wrap our heads around. Just really taking in all the barriers that there are for formerly incarcerated people, just barriers to reentry into, where we all live all the time. So please do check that out. There's a lot of great information on there. And I think we are about all done. Is there anything that Maria or Jess that you would want to wrap up with?
Maria, do you want to start, and then I'll wrap up?
Well, no, thank you for having me. I was a little nervous, but thank you for having me. And I hope, we get this program on and assist people that are in need, that, we're able to get benefits and now they can. So that's always a good thing, right?
That's right. I thought you did great, Maria. And I would say that this is just the beginning of trying to repeal the very long and arduous policies that have been employed against low-income people, mostly people of color, in the name of the fight against drugs. There were several policy changes made last year that reflect that lawmakers understand this went way too far and sent a lot of people to prison and jails that didn't need to be there, spending $50,000 a year in jail costs for each person, when we could have otherwise spent that money to provide mental health services and drug rehab services and education and support for kids to prevent them from going into drug use. You know, there's such a better way to spend our money on our people than for a prison sale. And I'm just so proud that California is leading the way on this. This is a big piece of it. There are many more to go. And if people are inspired by this kind of decriminalization and holistic support of each other, I encourage you to go and sign on to a campaign I'm really excited about this year, which is the Right to Rest Act. This is an act we hope to get introduced here in California, which would make it, once again, legal to rest in public, to sit, to lie down in public, and not to criminalize an act that we all have to do every day to survive, and simply because somebody doesn't have a home. So I just want to say thank you to CFB for having this venue, and also for the immense partnership over the years on this campaign. And I look forward to the next webinar. I'm learning a lot from the webinars that you're hosting and posting online. Thank you.
Thank you both so much. That was amazing, super relevant, timely information for all of us to take back to work with us. Again, thanks to Jessica Bartholow from Western Center on Law and Poverty, and Maria Abarca from the Neighborhood Health Care Center based in East San Diego County. Again, the webinar will be posted. Steph will send an email out to everybody when the recording has been posted to the website. Should be a few days to a week. Thank you all so much.